Congenital cardiovascular disorders are heart defects that are present at birth. So something happened during development that caused these congenital disorders. So in the category of vascular, valvular, electrophysiological, or cardiomyopathy, some of the congenital cardiovascular disorders can go in those categories. And some of them are just kind of in a category all their own. Some of them have to do with just the arrangement of things. And as you know, that all the parts of the heart kind of work in lockstep together to pump properly. So if one of those parts is either missing or not working correctly or arranged differently, it's just not going to work. So we're going to look at congenital cardiovascular disorders and their clinical significance, the four major types of heart defects, congenital heart defects, pathophysiology and briefly symptoms of each condition, and the PT implications. And again, as always, we're going to look for the signs that require immediate medical attention. So heart problems that are present at birth that occur during fetal heart development are considered congenital heart defects. So in normal fetal circulation, we have an opening between the two atria, which is called the patent, meaning open, foramen ovale, which allows the blood to bypass the non-functional lungs. So normally in an adult person in the air-breathing world, the venous blood comes in through the right atrium, goes down to the right ventricle, gets pumped out to the lungs. The oxygenated blood from the lungs comes in through the left atrium, goes down to the left ventricle, and gets pumped out through the aorta. Well, the fetal lungs aren't working yet. And so you get the oxygenated blood from your mother. It comes in through the right atrium. And instead of going to the right ventricle and into the lungs, it goes straight over through the patent foramen ovale into the left atrium to get pumped out to the rest of the body. So when the baby's born, the lungs begin to work and the heart structures normally adapt. Sometimes they don't, though. And so if you, after birth, if you have a patent foramen ovale, it requires surgery to correct. Shunting is when there's abnormal blood flow between heart chambers. So in the fetal stage, the blood flow between the right atrium and the left atrium is normal. After birth, that's not normal. And so we don't want that to happen. Because then what happens is deoxygenated blood gets into the left atrium and the left ventricle and goes out and produces cyanosis because it's of poor oxygenation. So you get that blue discoloration. So normally after birth, the left side is oxygenated blood and the right side is deoxygenated blood. So the right side has to go to the lungs, the left side goes out to the rest of the body. So you can have septal defects either between the two atria or between the two ventricles. So an atrial septal defect, you can have an opening between the right and left atria, and that's normal during fetal development, but then after birth, it's supposed to close. So you can have a left to right shunt where oxygenated blood recirculates, which causes right atrium enlargement. And that's less severe because more oxygenated blood is not as much of a problem as less oxygenated blood. If you have a right to left shunt, that means your deoxygenated blood is now going out to the body and you get poor oxygenation. That's a more serious problem. So someone who has an atrial septal defect, you want to monitor for exercise intolerance, fatigue, and shortness of breath during activities. And of course, cyanosis is going to be a sign that might show up. A ventral septal defect is an opening between the right and left ventricles. So if you have a left to right shunt, because the left ventricle has higher pressure than the right, right ventricle pressure increases as it progresses, and then the shunt reverses right to left. So the clinical presentations, if you have a small defect, it might close naturally with no symptoms. If you have a large defect, it could cause cyanosis, fatigue, shortness of breath, and heart failure. This is more common in Down syndrome patients. So the surgery required for large defects Um, Surgery is required for large defects to prevent heart failure. Since they've developed good early surgeries, people who are born with septal defects are living longer and not having the side effects, which is great. It's great that they can do those surgeries now. Sometimes if the defect is small, the septal defects, you can go through your whole life and not know you even have it until something shows up later on. I read one study where people, a certain percentage of people who suffer from migraines actually had a small patent foramen or ovale that persisted into adulthood. It wasn't serious enough for them to have noticeable symptoms when they were younger, but then the symptoms that developed as they were older included migraine headaches. So I thought that was pretty interesting. The teratology of Fallot, or TOF, is the most common cyanosis causing congenital heart defect. They used to call it blue baby syndrome because it causes cyanosis. But it's a defect that's apparent at or soon after birth. The baby is going to have a bluish tint, mostly around the nose and mouth and the fingernail and toenail beds. The condition is it's four separate defects that combine to cause significant problems getting oxygenated blood pumped through the body. So you have pulmonary valve stenosis. So the pulmonary valve is stiff and narrowed and doesn't open completely. And you have right ventricular hypertrophy because the right ventricle is having to work against that pulmonary valve stenosis to work harder. And you have a ventricular septal defect, blood mixing between the ventricles. And you have what's called an overriding aorta, where the aorta is positioned over the ventricles. So, this is another thing that is more common in people with Down syndrome, which is a genetic disorder, a trisomy 21. Um, it's generally surgically repaired during the first year of life. And so people with syndrome are living longer because there are surgeries that can correct these things, which is great. So transposition of the great arteries is an infrequent and serious congenital cardiac condition. Um, Sometimes it's called transposition of the great arteries or transposition of the great vessels. Basically, the aorta and the pulmonary artery are switched. So the right ventricle sends deoxygenated blood out through the aorta to the body. That's not good. And the left ventricle sends oxygenated blood back to the lungs. So that's a mix up. It requires surgical intervention within the first few weeks of life, and that's critical. There's severe cyanosis. With surgery, over 90% of people can lead full and active lives. And so if it's detected early and they have surgery within the first few weeks of life, they can fix that, which is great. That's not a good condition. Cardiomyopathy is a disorder of the cardiac, any disorder of the cardiac muscle is called cardiomyopathy, whether it's genetic or acquired. So lots of different things, lots of different causes. The the cardiac muscle can be stiff and thick or distended and flimsy. So flimsy, I think, is a funny word, but so if it's stiff and thick, you have decreased ventricle size, you're going to have less cardiac output. If it's stiff and thick, you're going to have reduced elasticity and poor filling. If it's distended and flimsy, the walls are going to be thinned, you have a weakened contraction, and you have poor pumping. Okay, what does that sound like? Poor filling is diastolic heart failure. Poor pumping is systolic heart failure. So the symptoms, which are often silent at first, but they show up later: lightheadedness, syncope, which is fainting, shortness of breath or dyspnea, fatigue, lower extremity swelling, arrhythmias, and sudden cardiac death. So the cardiac muscle is inherently either stiff or thick or distended and flimsy. And that's where this one results from. The treatment is similar to the treatment for heart failure from any other reason. So in physical therapy, Assessment priorities include assessing exercise tolerance. We're monitoring for fatigue and dyspnea, shortness of breath. Oxygen saturation, we're going to watch for desaturation. We're going to take heart rate and blood pressure response before, during, and after exercise. And we're going to look for signs of cyanosis around the lips, fingernails, and toenails. Um, for activity modification, the person might need frequent rest breaks during activities. You always want to monitor the response to exercise and avoid overexertion, and consider teaching energy conservation techniques. So the red flags include new or worsening cyanosis, severe shortness of breath, chest pain, syncope, or irregular heart rhythm. The major congenital defects are atrial septum disorder, ventricular septum disorder, tetralogy of Fallot, which is the four defects, cyanotic from birth, transposition, where you switch the great vessels, and that needs emergency surgery right away, and cardiomyopathy, which is a muscle disorder, which is often silent initially. So you're always going to assess exercise tolerance carefully with any cardiac patient. You're going to monitor for signs of poor oxygenation, so low O2 sats and cyanosis. And you're going to know when to stop the activity and seek help and understand the impact on functional capacity.